Hey mama, welcome back to another episode of the Silent Emergency, where we talk about nutrition in pregnant women. Today we're going to talk about 5 ways you can prevent anemia during pregnancy or considerably reduce your risk of becoming anemic during pregnancy. Number 1 is to incorporate iron-rich foods into every meal. So the first thing we need to look at is your plate, right? So whenever you want to eat, at least one meal a day should have foods that are rich in iron, like your liver, your meat, your fish, your eggs, your crayfish. You see, these little things make a world of difference. So you don't have to completely overhaul your diet or start eating things that you're not familiar with. There are so many foods that you are, familiar with, your local foods like your ugu, your spinach, that are rich in iron. So when you have your meals, always make sure that at least one component of your plate is, an iron-rich food. Number 2 is to pair these iron-rich foods with foods that are rich in vitamin C. So iron does not work alone. Your body absorbs iron much better when you have them with meals that are rich in vitamin C, like your tomatoes, your fresh pepper, your citrusy fruits like oranges. So when you make this tiny change, it helps your body to respond to iron much better. Number 3 is your supplements or prenatals. Always take your prenatals. If your midwife has prescribed prenatals to you, please take them. Even if your midwife has not prescribed prenatals to you, it is always much helpful when you take prenatals because they're already fortified with the nutrients and vitamins that you need to support your body during the period of pregnancy. Always check with your midwife also or your doctor because you might already be taking some supplements that are already rich in certain vitamins and you don't want to have too much of them in your body. But as long as your doctor or your midwife gives you the green light, please do not skip your prenatals or your supplements because it helps your body. Even when you're taking foods that are not, rich in the certain vitamins and nutrients that you need, or you're not getting the daily recommended intake, this supplement helps to buffer it. It helps to, they're called supplements for a reason. They supplement these vitamins and these nutrients, and they help your body prepare for pregnancy if you're not pregnant, and they also help your body during the period of pregnancy and helps your baby while you're pregnant. Number 4 is to not dismiss any symptom. If you've been tired, dizzy, well, sometimes it might be normal during pregnancy to feel tired, but if you've been feeling dizzy or lightheaded, you need to make sure you speak to someone and get a blood test. Anemia often presents with lightheadedness, dizziness, feeling of exhaustion. So when you're anemic, these symptoms present, but it's always much helpful when you don't dismiss them during pregnancy just because these things also sometimes occur normally as a normal side effect of pregnancy. So whenever you feel dizzy or lightheaded, don't just take it as, oh yeah, I'm pregnant. Of course, I'm creating another human being, so I'm supposed to be tired. Always make sure that you properly check with your doctor. Always err on the side of caution. It is better if you go to the hospital and they tell you that nothing is wrong with you and you're fine than to dismiss it and assume that you're fine, and unfortunately, you're running low on your hemoglobin and you're becoming anemic, because then it can restrict the blood flow that your baby is getting, right? And that can harm you and also harm your baby. So do not dismiss any symptom. And then number 5 would be always attending your antenatals. Please do not skip your antenatal appointments, because when you go for your antenatals, the questions that they ask you and the screenings that they give you also helps them to properly understand what's going on in your body. And you can also request for a blood test. So it's always good when you have a blood test while you're pregnant, not just to confirm pregnancy, but also to know the state of your body. You can ask for a full blood count so they get to understand, what are the levels of your red blood cells, your white blood cells, your hemoglobin levels, so that when anything is out of range, they know how to respond immediately. You see, when you target these things ASAP, it helps to reduce the risk of side effects. So please make sure that you incorporate these little tips into your everyday life, and they make a world of difference. Just making sure that every single plate that you eat has iron-rich supplement, you're pairing it with vitamin C, you're not dismissing any symptoms, you're attending your antenatals, and you're taking your supplements. These little things that you can do every single day can prevent you from becoming anemic during pregnancy. Thank you, mamas. Bye.